In the realm of dentistry, the prevailing wisdom dictates that a cavity demands immediate intervention, typically in the form of composite fillings, crowns, or onlays. While this approach holds merit and is successful in many cases, it often overlooks the holistic considerations crucial for personalized care. With over 4 decades of practice under my belt, I've observed a recurring trend. Teeth subject to multiple restorations frequently encounter more significant issues down the line. Over the years, I've encountered numerous patients in their golden years, often in their 70s and 80s, who've undergone extensive dental procedures like crowns and root canals. Unfortunately, many of them now faced a host of issues, including recurring non-restorable cavities and infections. Managing these complex problems becomes especially challenging given their overall health status at this stage of life. For example, this patient underwent multiple crown placements, some of which later necessitated root canals. Subsequently, some of the root canals failed, leading to extractions. Presently, she lacks molars on the lower right side and experiences discomfort with the upper right bridge. Additionally, the upper left bridge anchor, which underwent root canal treatment, is now infected and requires extraction, resulting in the loss of the entire bridge. These complex issues raise important considerations and prompt deeper reflection. Consider this patient, diagnosed with root surface cavities, notorious for their challenging prognosis. See number 9, entitled Root Cavities, in the info sheet table of contents on www.holisticdentallearning.com to see the reasons why. Instead of hastily resorting to restorations, this patient embarked on a different path by prioritizing meticulous oral hygiene, embracing remineralization techniques, and adopting a nutrient-rich diet. While cutting way back on sugars, he succeeded in halting the decay progression over a span of 7 years. This scenario challenges the prevailing notion that all cavities inevitably worsen and underscores the profound benefit of conservative management strategies. By tailoring treatment plans to individual needs and empowering patients to make informed decisions, whole health dental professionals can achieve outcomes that not only address immediate concerns, but also foster long-term oral health and well-being. If remineralization and preventive strategies are chosen as the preferred treatment approach, it's essential to establish a very specific reevaluation protocol and establish baseline parameters using appropriate x-rays and photographs for future reference and comparison. In cases where patients opt for restorations for root cavities primarily for aesthetic reasons, it's crucial to provide a comprehensive explanation of the risk prognosis. To delve deeper into this paradigm shift, let's examine 2 contrasting scenarios: a cavity between teeth that was able to be stopped versus one that led to pulp infection. The former, seen in these x-rays, was accessible to cleansing and remineralization and demonstrates a minimal progression over an 8-year period, a testament to the tooth's innate capacity for self-repair when provided with proper care and support. In contrast, this scenario, exacerbated by inaccessibility factors that the cracked filling impedes remineralization efforts, and the crack provides safe harbor for cavity-causing bacteria. The scenario necessitates a restoration due to circumstances hindering remineralization and bacterial control. The patient did not have this evaluated until there was extreme pain. The cavity got out of control and infected the pulp. Scientific research further bolsters this holistic approach, emphasizing the multifaceted nature of cavity progression. Factors such as oral hygiene practices, dietary choice, saliva composition, and genetic predispositions all exert significant influence. By considering the entirety of the individual, rather than fixating solely on the cavity itself, whole health dental professionals can deliver truly personalized care that not only addresses immediate concerns, but also promotes long-term oral health and well-being. Here is a scientific article entitled "Dental Caries, a Dynamic Disease Process." It discusses the caries balance. Caries is another name for cavities. Part of the conclusion, there are many possibilities to intervene in this continuing process to arrest or reverse the progress of the lesion. The diagram shows that when protective factors outweigh pathologic factors, that you do not get cavities. In the protective factors category, they list fluoride. Obviously, holistic dentists do not use fluoride. We use hydroxyapatite instead. And in the antibacterial list, they list chlorhexidine. Holistic dentists use ozonated water and ozonated oil instead. Here's another article, Infected Dentin Revisited. Dentin is the second layer of the tooth, right below the enamel. One of their conclusions is that the cavity infection is unimportant because the driving force for the lesion formation and progression is the overlying biofilm or bacteria. This explains why root surface cavities can be controlled by mechanical plaque control, and fluoride and restorations are not needed to arrest these lesions. These authors also promoted fluoride. However, again, holistic dentists do not use fluoride, but rather natural products like hydroxyapatite. And the third article, Detecting and Treating Occlusal Cavities, that is cavities on the chewing surface of the teeth, and they came to the conclusion that performing micro or non-invasive techniques instead of invasive ones after detecting a cavity lesion was found to greatly influence tooth retention and long-term costs. Now, let's take a closer look at the concept of personalized care within the realm of dentistry. At the heart of this approach lies a fundamental understanding. No two patients are alike, and their oral health needs will vary based on a myriad of factors, from lifestyle and dietary habits to overall health and genetic predispositions. When confronted with the cavity, the knee-jerk reaction may be to proceed with immediate restoration. However, this approach fails to account for underlying factors contributing to the cavity's development and progression. For example, if poor oral hygiene practices or dietary habits are identified as root causes, simply filling the cavity without addressing these underlying issues is akin to applying a Band-Aid to a larger problem. The tooth would still be susceptible to more cavities. Instead, a more nuanced approach is warranted, one that takes into consideration the patient's unique circumstances and empowers them to play an active role in their oral health journey. This may involve implementing targeted interventions such as dietary modifications, improved oral hygiene practice, or remineralization therapies aimed at bolstering the tooth's natural defenses against decay, to include such things as vitamin K2 supplementation to nourish the pulp from the inside out and to bolster the reparative function of the odontoblast cells in the pulp. If there is genetic predisposition, unique approaches like specially designed retainers that hold remineralizing hydroxyapatite next to the teeth throughout the night can be an added defense against cavities. By adopting this personalized approach, whole health dental professionals can not only address immediate concerns, but also lay the foundation for long-term oral health and well-being. Moreover, by fostering open communication and collaboration with patients, whole health dental professionals can empower them to take ownership of their oral health and make informed decisions that align with their individual needs and preferences. In conclusion, the conventional wisdom dictating immediate restoration for cavities warrants a critical reevaluation in light of the holistic whole person approach. This is in no way saying that dentistry is never needed. Various dental procedures have proven to be extremely beneficial. The proviso is that the treatment needs to be determined only after thoughtful consideration and not based on the fact simply that it's a cavity and needs to be fixed right now. By considering the entirety of the individual, from their lifestyle and dietary habits to their overall health and genetic predispositions, whole health dental professionals can deliver truly personalized care that not only addresses the immediate concerns, but also fosters long-term oral health and well-being. This paradigm shift underscores the profound impact of personalized care in whole health dentistry and highlights the importance of empowering patients to play an active role in their oral health journey. For more information, see www.holisticdentallearning.com.